Hello, everyone. Welcome to the third part of our discussion on conducting meaningful research in physiotherapy. In this third part, we are going to discuss further about what other major contributors to meaningful research, conducting meaningful research in physiotherapy. So in last week, we in the last discussion, we discussed about external factors, infrastructure and so on. Now, I want to move further and look at factors that are within the researcher that might be helping or preventing them from conducting meaningful research. So, what are the major problems the physiotherapist has to address that is within their hand? Uh, that would help them to conduct meaningful research.
I think the buzzword is in their hand because there are a lot of contextual factors which we may
Yeah.
not be able to solve or have any solution for that. I think one of the most important thing I think is the content expertise in whatever you're going to try to do, and also have some
Can you elaborate
clinical.
on what you mean by content expertise?
I'll just add the other point and then we'll
Right.
move into it.
Okay. Yeah.
And then have some clinical intuition that okay, these seems to be a problem in my clinic when I'm treating. So is this really a problem? They have already found a solution, or there is solutions for that, or that kind of intuitive ideas about
Yeah.
the problems we face every day. So these are the two factors I think we can inculcate and develop. Um, so what I mean by content knowledge is understanding about a particular issue. And now, if if one of the one of the issues which I have noticed, I think you should have also noticed, is people assume that there is less in physiotherapy and they know most of it because they have read 2 or 3 books in college. And they have this defeatist idea that there is nothing more to
Yeah.
do or nothing more to learn, that kind of thing. I think that is a sort of bringing us down in the sense that that's not allowing us to explore the content knowledge of it. What are the ideas behind it? And also there is certain amount of looking at the West, I suppose, where if they have already produced a particular content, they think that that is the end of it.
Right.
So
Sorry to
rather than
interrupt. One of the problem, especially what you're pointing out, that there isn't much new to do. The reason is most of them thinking in terms of only solutions,
Mhm.
treatment. Because we don't seems to question that the theory might be wrong or
Yeah.
whatever contributors to the problem, because problem can be wrong. We seem to have a set idea that all these things already we know for sure, because that's how it
Mhm.
is taught.
Mhm.
Say for example, osteoarthritis knee, you have muscle weakness, that is what is causing the problem, especially VMO weakness. So many tend to think that that's a fact, that's a settled issue, except that it is not. So that's, I think, one of the important reason why they think that there's nothing new.
And also the one of the things I do, if say for example, if I'm trying to understand about functional rehabilitation, which is my favorite topic, I suppose.
Yeah.
I also try to find out, okay, what is the criticism or what is the problems in these things? What is the alternate theoretical idea which supports or which disproves that? Disprove is a sort of strong word, I suppose, which says that, okay, these are the criticisms in this
Yeah.
idea. So if you read that, it's not for saying that something is wrong or something like that. Do I have my statements which can nullify that criticisms, right? So then only I know that I understand it clearly.
Yeah.
That helps me in understanding or getting my content knowledge more clearly, I think.
I think you can give the example of Citizen you have been saying, when it comes, even if for treatment, you can ask different questions, by asking the outcome is, not just independence, but how quickly or they can get the outcome, the time to event in this case, right? These are
Right,
all our patients often ask this question of when will I be,
right,
and they would really love to achieve an outcome faster, even though it's an outcome most of them achieve, right? So if you
right,
think from a
correct,
patient
correct.
perspective rather than just what we are trying to get it, you know.
Uh, exactly. I'm assuming in the acute stage, when will I go home is
Yeah,
the uh, biggest thing. Even when you or I get admitted, the first question is when will
yeah.
they let me off this place, right? So I think that's a good outcome you can have and try to work on that. Okay, you can now. This is what I mean by clinical intuition. Okay, right. So, have people done that? Have they looked into it? What is the name for this idea? How do they measure? So you can sort of. It'll be a whole new thing you have to learn about rather than understanding what treatment which I'm assuming you can learn in 2 minutes.
Yeah.
But the other parts of it will be far more difficult to know because we were not taught like that.
If I have to make one statement to put this across, I think we have to start by questioning status quo rather
Yeah.
than just accepting everything correct, and that's why we don't find something new. What do you think?
So the first question I ask when I talk to not to my students when I talk to people who are in my age or probably in the 40s or something like that, when they get into studying or they think that they ask me that I want to study, the first thing I tell them is ask them a few questions, right? So one of the common questions I ask them is, okay, what is your OA treatment? And they will tell me, always there is electrotherapy. I don't
Yeah.
mind that. And that's not a issue because somebody is telling them also to do that. So that's not a quarrel I have now, at least. Most of them tell me that it's isometric exercise and things like that. And I ask them, okay, the patient came walking, but we are giving
Yeah.
isometric exercise. Does it make any sense? Uh, so this is not to say that I got you or something like that.
Yeah.
It is to make them understand that there is something fundamentally wrong in how we understood this. This is not what I taught or anything. This is what I was taught. This is what was done, which is still happening. That is the sad thing. So if you sort of know how to question your own knowledge, which is difficult, that's why somebody else has to do it for you. Then you will know that your content knowledge is skewed or completely
Yeah.
nonsensical. So you can move on to the next piece.
Yeah.
Also
I'll
to
just finish
understand better.
this topic by just adding one point. Is that because research always, on questioning status quo, but the irony
Yeah.
is that most of us are unafraid of afraid of questioning because they think that questioning exercise effectiveness is questioning the value of profession itself, but it's the progressing profession because somebody we are doing something else like 20 years ago somebody questioned it, that's how new things have come, but except that there is an emotional reaction to it when we say things like that, isn't it?
Yeah. Uh, and the defensive recoiling which happens inside, we need to overcome that. Remember, we all had it. We will all have it now also. If somebody comes and tells me that whatever you wrote in your book is rubbish, the first reaction will be, what sort of idiot are you? But that you need to overcome that and say, okay, where am I wrong? Because I know now there is so much of mistakes in the
Yeah.
way I wrote or what I taught. So you need to keep on progressing or moving on. That is the what we mean by content knowledge.
Yeah. So basically, if you're a researcher interested in getting something out of it, This simple thing is that question every tool that you're using. Is this really a useful tool? Is this don't just parrot somebody's statement that is valid and reliable. Question: is it really valid? Is it really? It is the simplest thing you can start off.
No, the first
Right?
question I suppose is, what do you mean by validity?
Yeah. Right. So that's how you will move next and next, and you will have literally hundreds of problem for you to work with. So you can take the simplest one if you're in an early career, right? Basically, you must be unafraid of questioning, and whenever we are questioning, it should be from the patient's perspective. That can really take us to a meaningful and valuable research, right? So moving on. Content knowledge is one of the major barrier people has to work out if they have to come up with questions that are really interesting. What other factors people have to get?
Now, a lot of people think that novelty is a valuable issue. I'm not questioning it. Novelty is novelty. There's no. Sometimes if I find something novel, I'm super excited. That's not an issue. But one of the things, or one of the hallmarks of science is repeatability.
Yeah.
Right. So one of the studies they have done is they have tried 100 published results in basic science, and they tried to replicate it, and they couldn't replicate, or they couldn't get the same result probably in 20 to 25%. I'm not sure about the number because it's sort of a long time I've read that. So what it means is either there is some issue with the probability that sometimes it works, sometimes it doesn't work. So you need a larger data, or manipulated the results also. We don't know, because there are a lot of things happening like that. Every time you find whether it is physiotherapy or stem cell research, somebody is fudging the data, right? So repeatability within our context, I think that is one area which I think we need to focus, and we need to do a lot of things, because India is basically a continent, and repeatability for Indian context is, I think that's one of the important things we are missing out.
You might find it a bit challenging to publish, but you can get there. That's not a big issue. But the novelty point, I look at it differently. The novelty need not necessarily about a new problem. It can be your approach of the method by which you want to address that itself. You can have novelty. You can look at the same problem, but you look at it in a slightly different way. Everybody is using it, and maybe something is not working. You just have an entirely different method in using different test that you're looking at. Data analysis, you're just looking at from a different point of view, or the same result, you are just giving a new perspective to how to look at it. That may be something people missed out. So there can be novelty in many different ways. It need not be seen from the narrow perspective of the problem needs to be something new.
That's what I mean by repeatability within the context also. There are so many different contexts within which the clinical research is done, right? So we can say, for example, one of the common questions I still have not found any a sure answer for that. If you are living in Tirupati or someplace which rains crazy, or if you are living in Ooty, right? I'm pretty sure the stroke rehabilitation is far more complicated than what happens in Chennai, right? How are they adapting to that? Is it more challenging, less challenging? But it's all the same. We don't have the slightest clue. So if you have a repeatability trial for walking practice in a rural setting and in say Netherlands Road or even Netherlands rural place, it might be completely different. But that's what I mean by sort of tweaking the context to our problems and things like that, along with repeatability.
Okay. I think these two is there are many. Of course, we can't discuss everything within
Yeah.
in a video as such. But these
Mm.
two are far more important and probably higher priority issues to address, which
Yeah.
we think will lead to more meaningful research. Do
And
you?
also it's in my
Yeah.
hand, I suppose.
Yes. Sorry.
It's in within my
Okay,
control.
right. So within the definition of whatever is our control, we could say
Yeah.
that we have more to, we have more opportunity to change that. So this people who are interested really want to change physiotherapy, and by conducting meaningful research, maybe these are all areas that you want to start with. So we'll end this session with a quick summary or any other point that you want to add.
Uh, uh, the one thing is uh, all these content knowledge and things it takes a lot of time. So uh, perseverance and patience is definitely a hallmark of any good researcher. So I think that's that's one thing we need to again cultivate within ourselves.
Right. So with the perseverance and patience will be our take-home message. We will meet again in another video. Again, thank you for listening, and please subscribe to our channel.
Okay, bye bye.
Bye-bye.